Hello, everyone, and welcome to Official SWAD for Nursing Assistant Skills and Education, your true way to success. In this presentation, we'll be talking about why and how to apply elasticized stocking, known as elastic stocking, attached stocking, and or anti-embolism stocking. After this presentation, I'm going to follow a video with a skill demonstration. So the elasticides or elastic stocking or titch stocking, they are extended from the ankle or foot to calf or mid-thigh. They are always applied to reduce the incidence or the risk of thrombophlebitis, which is the inflammation of the vein that can lead to blood clots. So before applying the elastic stocking, you should have a doctor order for that, and you should have a care plan. The care plan is when you put them on and when you take them off. Usually, we put them on in the morning before a patient get up from the bed or out of the bed, and we take them out at night when patient go back to sleep. We need to apply the stocking before your patient gets out of the bed. For some reason, your patient is out of the bed, either to eat breakfast or to use the restroom or so on. So have your patient go back to bed, raise the feet, put a pillow under them for 20 to 30 minutes, then proceed and apply those stocking. So make sure the legs are dry. If it's not, dry them well. Never apply the stocking over an open area like wound. Never apply them over fracture or deformities. Make sure the stocking are applied smoothly with no wrinkles. Check the stocking every few hours to be sure the top have not rolled or turned down, and monitor the circulation in patient toes every 2 to 4 hours. It is very important to have the right size for your patient because as the figure illustrate that they come in different sizes. We have the small, we have extra small, we have also medium and large and extra large. So make sure to have the right stacking for your patient. There are 10 steps to apply knee-high elastic stacking. Make sure to practice them, to learn them, so to carry them on properly or correctly during either your skills exam or where you're working. Always be advised when you knock your patient door and you enter his or her room, or you enter the room, patient's room, greeting, introduce yourself, explain the procedure, provide privacy. Make sure that your patient is in supine position, which is on the back. Turn stocking inside out at least half the way or at least to the heel. Place foot of stocking over toes, foot and heel. Put top of the stocking over the foot, heel, and leg. Once you finish, make sure there are no wrinkles, signaling or signaling device within the reach of your patient. Bed locked in its low position. You wash your hand and your scalp. Pronounce the scale is finished. So the next video, or the following video after this slide, you're gonna do is gonna be about demonstration of the scales. But before we proceed, I want to thank everyone for subscribing, watching, liking, and commenting. Should you have any suggestions, questions, please feel free to reach out. And because it is a new channel, we promise you more educational materials on the way. Okay, thank you very much. See you at the
Remember
end.
that your patient or your client may be at home, in a hospital, or a nursing home. Make sure to gather your supply and knock the door, your patient door, your client door, and take permission to come in. Once you go in, introduce yourself, explain the procedure, expose one limb, and don't forget to provide privacy. Take off the socks if there are. Check the foot for wounds, deformities, or abnormality. Make sure the socks or the stocking are the right size for your patient. Turn stocking inside out, at least to the heel. Place foot of stocking over toes, foot, and heel. Pull top of stocking over foot, heel, and leg. Move foot and leg gently and naturally, avoiding forces and overextension of the limb and joint. Make sure that there are no wrinkles and it is smooth from bottom to top. Toes of the stocking on the toes, on your toes, heel on the heel. Finish your procedure by covering back your patient. Signaling device within the patient reach. Bed low position and locked. Ask your patient if he needs something to call you. Wash your hand and skill is complete.